Hello again, everybody, and welcome to another InsideLowell podcast. This one is a Health Minute brought to you by Wellpoint. I'm your host, Teddy Panos, coming to you from the Wellpoint studios. Wellpoint is the only health plan offering benefits exclusively to Massachusetts GIC members. At Wellpoint, your whole health is their whole point. And we thank our friends at Wellpoint for sponsoring this Health Minute. And we thank Dr. Carolyn Langer, the health director at Wellpoint, for joining us here in the Wellpoint studios. Hello again, Dr. Langer. Welcome on this beautiful, crisp October day. Gorgeous weather we're having.
Oh, it is. It is lovely. I just hope it lasts a while.
Yes. Let's go right to spring. I'll be okay with that. If we
I'm perfectly fine skipping through winter.
All right. Of course, it is October, and we have to go through it. But if for folks who didn't notice all the pink ribbons out there and the pink police cruisers, they're professional athletes wearing pink sneakers or whatever else. October is Breast Cancer Awareness
And I didn't
Month.
have a pink blazer, so this is the closest I could
All
get.
right. Yeah, pink does not look good on me. It makes me look fat. And then all the other health minutes that you've told me about, keeping in shape will go out the window. But let's talk a little bit about Breast Cancer Awareness Month. First of all, define breast cancer, if you would.
Yeah. Breast cancer is cancer that starts in one or more breasts, and it can really occur in any race or ethnicity, although it does affect some groups differently. On average, about 1 in 8 women will develop breast cancer during her lifetime.
Wow, I did not realize the number was that high. So how do you detect it? Screenings, self-examinations? How's it done?
So it's really important to get regular screenings. That is one of the factors that is within your control. There are some factors that are not within your control, some risk factors such as getting older or family history, but regular screenings with mammography is definitely within your control.
All right. And when should you start getting a mammogram?
Yeah, so most women would start by getting mammograms every 1 to 2 years, starting at the age of 40, and then annually, starting at the age of 50. This can vary, and it's important to consult with your physician, because if you have certain risk factors, they may want you to start earlier or have more frequent mammograms.
Has the medicine behind that changed? Didn't it used to start at 50 and then they moved it back to 40, right? Because they were missing a lot of diagnoses, right?
Yes.
And you said every 1 to 2 years in between 40 and 50, and then regularly every year.
Right, every year.
Okay. What should people expect when they take this exam? Is it a scary exam? I hear a lot of women talking about it, saying, "Oh, I have to go," especially the first one, right? Any kind of test causes angst. But is the mammogram something to fear?
No, absolutely not. And there really is nothing to be concerned about. It's a very brief test. It takes about 10 to 15 minutes. Typically, during the screening, the technician will take pictures of your breasts with an X-ray machine. Again, it's a very safe, simple procedure. Most often, the imaging studies would be sent to a radiologist who's a doctor who specializes in interpreting X-rays. And then typically you would get a report within a couple of weeks.
All right. Well, what does that report mean? Because when you say the number 1 in 8 will come back with breast cancer, that scares people, right? Especially when you hear that C word. So what do the results mean? It's not a death sentence, right?
Oh, absolutely not. So the radiologist will check for anything out of the ordinary. They'll compare your X-rays to previous mammograms if you've had them, and they'll look for certain changes in your breasts. Now, as you said, an abnormal mammogram doesn't necessarily mean that you have breast cancer. There are many harmless causes of an abnormal mammogram. So, for example, a woman could have a dense breast, she could have minor cysts, or the X-rays may simply be very difficult to read. If the results are abnormal, your doctor will typically ask you to come back for some additional testing. And if your additional testing does show that you have breast cancer, you and your doctor can develop a treatment plan. There are many options for treating breast cancer, especially when it's found in the early stages. And that's why it is so important to get that screening on a regular basis, starting at the age of 40, if you have no risk factors, and potentially earlier in consultation with your doctor.
Okay. And you mentioned kind of briefly who is at risk, but if you wouldn't mind just kind of reviewing that, and also
Sure.
the ways to reduce that risk. Are there ways to reduce the risk, or are you kind of at the mercy of nature and, your genealogy?
Yeah, no, there definitely are some things that you can do to reduce your risk. Again, the things that really you can't change are getting older, family history. But some things that you can do, we talked already about the importance of getting regular screening mammography. But the other things that you can do are make certain lifestyle changes. So, for example, maintaining a healthy weight, exercising regularly, drinking alcohol in moderation or not drinking at all. These are just some examples.
All right. The last question, and
Sure.
this is not a joke, but I've heard cases of it. It does occur sometimes in men. Should men be concerned? Is this a conversation I need to really kind of go back and rewatch, or is it the risk so low that it's not really worth going and worrying about?
No, it's a great point because we often forget that breast cancer can occur in men. So it's important if you're a male, again, if you notice anything out of the ordinary, unusual lumps or disfiguration or anything that might seem unusual to you, it's important that you consult with your doctor.
All right. Some great information out there. October is Breast Cancer Awareness Month, and we hope that we've raised awareness. I think you certainly have.
Thank
Dr.
you.
Langer, thanks so much for joining us. We'll talk to you in November, okay?
Look forward to seeing you then.
All right,
Take care.
thank you. And thank all of you for joining us as well here on this latest Health Minute, sponsored by Wellpoint. Till next time, everybody stay safe and please stay healthy.